On this episode, we'll talk about how to lose 100 pounds. We'll also talk about burping and taking occasional anti-inflammatories. Hello everyone, I'm Dr. Alvarez. Welcome to episode 56 of the AskDrA show. And thank you so much for submitting your questions using the hashtag AskDrA or sending me the questions via Snapchat with my username that we'll place here on the screen. Let's get into the show.
What is the fastest way to lose 100 pounds?
All right, so what's the easiest way to lose 100 pounds? Get gastric sleeve surgery, number one. It's not that simple, of course. You need to work with things. Remember that the sleeve is a tool, but it's a very powerful tool. It's a very powerful tool that will help you get to that goal. Set small goals, set achievable goals, little by little, losing the first 20 pounds, the first 50 pounds, then the next 20 or 30 more to 70 pounds. By the time you know it, you've completed the task of coming down 100 pounds. You need to work with it. Please work with your sleeve. Wise decisions. I mean, I tell you again and again, I'm sorry, but it's important for you to understand that sleeve is not magical. It's a very powerful tool that without it is practically impossible, all right? But with the tool, learning how to work with it, it is very powerful to make you lose 100 pounds or 50 pounds that you need to lose, or 70 pounds or 150 pounds or maybe 200 pounds. Whatever it is with the tool, it is achievable. But please make wise decisions, work, do a little bit of exercise. It'll make you feel good, all right? Take your supplements, all right?
Why does the sleeve cause them to belch as soon as you eat or drink?
All right, let's talk about burping. It's a very common question, especially people who are just a few weeks or maybe a few days out, or a few weeks or maybe a couple of months out. And people say, well, I burp a lot and it's kind of uncomfortable. Maybe it's a little bit, I get ashamed if I go to a restaurant, it causes me to burp. So look at this burping as a sign that the sleeve is swollen. Make sure you take a round of antacids for 15 days or a month, and it goes away. It's temporary. Please keep in mind this is temporary. As the swollen tissue comes down, that burping goes away. The burping is caused because the sleeve is swollen, and a little bit of air gets trapped along the pathway of the sleeve, not all the way down, so along the pathway. And if you move or you take a little bit of fluid or you take a little bit of food, that passage frees up and then that air flows up and you burp, all right? So nothing happens, it's just that it's swollen. But if you take your antacid, that space is created, and then there's that free flow of air, or that column of air, that will actually eliminate that burping sensation.
What about occasional use of Meloxicam?
All right, let's talk about occasional use of anti-inflammatories. Is it okay? Yeah. Check first with your surgeon and your doctor. Meloxicam is one of the common anti-inflammatories used, especially for osteomuscular aches, knee pain, lower back pain, etc. You can take it just for a short period of time, same as ibuprofen. Please check with your doctor, make sure it's safe, and make sure how long you're going to be taking and the dose. There are other options. Instead of taking like Meloxicam, you can take a Celebrex, which is easier on your stomach, on your sleeve. So you can also check with your surgeon other possibilities, other medications that you use instead of the anti-inflammatories. So that's it for episode 56 of the AskDrA show. Thank you so much for subscribing to the channel. Don't forget to subscribe. That way you get notified every time we upload a new video, that new videos come each and every week, all right? You don't want to miss them. So subscribe to the channel, link me to your phone with my phone via Snapchat, send me a snap, say hello, all right? And question of the week is, did you have that burping sensation? Yes, no? Answers down below. I want to hear from you. Take care. Bye-bye.